Brought to you by the Future Faces of Healthcare. We introduce you to Carrot, a Manhattanite living in 10019. Let's see how her zip code affects her health. We will discuss our main health focus, obesity, and how obesity rates in other boroughs compare to hers. In addition, we will touch on problems and solutions for this topic.
Let's touch on the topic obesity. Obesity is a disease or condition that causes multiple other health conditions such as cardiovascular disease, non insulin dependent diabetes, mellitus, obstructive pulmonary disease, arthritis, and cancer, based on having too much body fat. The weight may come from the muscle, bone, fat, and/or water. This affects both children and adults, impacting hormones and metabolism. Here's a quick statistic. New York City has particularly suffered from this epidemic of childhood obesity. Recent studies of New York City children show that 15 to 19.4% of children are overweight, and an additional 22 to 27% of children are obese. We see similar trends in our cohort study. 21% of 5-year-olds were obese, as were 25% of those followed to age 7.
This next slide will allow us to compare and contrast why obesity ranges are higher in other areas than the one in Cary's zip code. It's crucial to mention these differences because in our research, we have noticed that the more educated people are about obesity and how to prevent it, the faster they can take action to solve the condition from further developing or worsening into other multiple health conditions, such as cardiovascular disease, diabetes mellitus, arthritis, etc. Now we will continue along by viewing how these area codes have major health disparities by not only a geographical sense, but also from a socioeconomic standpoint.
Like talked about, Karis's zip code is at a higher risk for becoming diabetic. The main cause to this health disparity is that many of those living in Karis's zip code are not getting enough exercise and are already in obese state. Education and implementation of programs that encourage exercise and weight cuts reduces the chance of becoming diabetic in Karis's zip code. Karis had also noticed something different in other boroughs of NYC. For example, the diabetic rate in East Harlem can be seen to be 33%. Karis recognizes that these differences are due to many correlating factors such as smoking, drinking, and a lack of a healthy food environment. Now we'll talk about the different causes and solutions to these health disparities.
Karis wants to know what she can do to help her community lower the risk of obesity. To do that, she had to identify some of the problems that can cause obesity and present possible solutions. One of the main problems that Karis identified is the lack of public transportation, grocery stores, parks, and playgrounds. By putting those in areas where there's a higher risk of obesity, it can increase the amount of people who would want to like walk instead of take a car or the taxi. Another issue is the lack of healthier eating habits and the lack of access to healthy food options. By spreading awareness on the topic of what a healthy diet looks like, it can show people what they should be eating. And in addition to that, having access to healthier food options should be made available to the public so there is always a healthy option available to those who want it. Lastly, helping people with mental health issues. A lot of people have mental health issues, and even though it says mental health issues, it can also affect you physically. You may not have the energy to get up or like go out and exercise, and you may not eat 3 meals a day or overeat because of stress, anxiety, or whatever. A way to help is to make mental health resources accessible to everyone so everyone can get help and these won't be issues.
Another issue is lack of awareness about child obesity. Like most health conditions, is always to start early, to be preemptive. to become aware about children and the possible correct portions for them in order so they don't become obese later on in life. They'll start out with good habits and continue them on. Another issue is that most people attempting to lose weight, they need to connect with others who want to lose weight. Statistics show that when you have support, you are more likely to stay accountable in order to achieve your goals. On this slide, we're directing you to the BMI chart. And on the slide on the left, it shows you what your ratings is for to be underweight, normal, overweight, obese, clinically obese, and morbidly obese. And then how those different BMIs raises your chances of actually incurring a disease. The other picture on the right, it tells you how the BMI is actually calculated. And what you would do is just take your weight, convert it to kilograms, and then divide it by your height once converted to meters. And that'll give you what your BMI actually is. For your convenience, we have attached a glossary. Cardiovascular disease, non-insulin dependent diabetes mellitus, obstructive pulmonary disease, arthritis, cancer, BMI, prevalence, chronic disease, social determinants of health, the Flynn Act, disparity, health risk, hypertension, refined grains, and socioeconomic status.
Thank you for your time.
Here are our sources: Obesity by Columbia Public Health and The Health of the Northeast Bronx by New York City Department of Health and Mental Hygiene.